10 years old, coming in from Camp Oakwood. She was climbing a tree at camp, fell approximately 10 feet to the ground and bumped her head. She complained of pain in her forearm. No allergies or medications reported. 1, 2, 3. Nicole here is very familiar with the patient. Vital signs stable en route. The pupils were Perla on the scene.
Has she been lucid?
She's been a little groggy, but able to answer our questions okay.
Okay, thank you.
You're welcome.
Kate, my name is Dr. Andrea Grayson, and we're going to get you checked out and taken care of, okay? Look at this light for me. Good. And can you smile for me and stick your tongue out? Good job. Pupils are equal, round, and reactive to light and accommodation. And she's got good facial movement, which should mean her cranial nerves are fine.
Okay, BP is 115/70, breathing at 16 breaths per minute.
No signs of bleeding.
And we've got a bump on the head here.
I thought the paramedics already did all this.
We just need to establish whether any of their observations have changed. And get a good base reading of how she's doing right now. That way we can determine the best course of action to help her. Kate, do you know what day it is?
Tuesday.
Very good. Now, can you tell me what happened?
I was in a tree and I fell and hit my head.
Okay, she's a little disoriented, but not too bad. Based on that and the method of injury, I'm thinking we have a concussion here.
Her oxygen saturation level's at 99% breathing room air. Temp is at 98.7.
Heart rate's pretty normal at 85 and her blood flow's fine. So all vital signs look good and there's no indication of internal bleeding.
Okay, Kate, let's take a look at your arm. Let's get some pillows and ice packs over here. Kate, we're just going to support your arm and keep it still, okay? Did you notice if she landed on this arm?
She did. She put it out to break her fall.
Okay, Kate, can you wiggle your thumb for me, like this? Any pain with that movement?
A little.
Okay, now can you bring your fingers down to the middle of your hand, like this?
That hurts a lot.
And is it hurting right here? Okay, based on the nature of the fall and the way she's guarding her arm, and the location of the pain, I think we probably have a fracture in the forearm. There wasn't much pain when she moved her thumb, which is mostly connected to wrist tissue. But fingers are more connected to the forearm, and we had significant pain associated with the finger movement. Ryan, I want to get a CT scan of her head and spine to test for concussion. And I want to rule out any brain bleeding or damage to her nerve system. And let's get an x-ray of that arm.
All right.
Okay, let's go. Okay, Kate, so I took a look at your CT scan and everything looks fine with your head, neck, and spine. No bleeding, no serious damage. You just got a good bump on the noggin. That resulted in a slight concussion, as we thought. Looking at your x-ray, you had a small enough fracture in your arm that we just needed to push the bone back into place.
She's feeling a lot better.
Well, Kate, I took a look at the second set of x-rays that we did after the closed reduction of your arm, and your bones have reset perfectly.
When can I get my pink cast?
We're going to send you to another doctor in about 2 days. We just need to wait for the swelling to go down from your injury before we put a hard cast on it. Then you're going to have your pink cast for about 6 weeks. But it should be off by the time you go back to school.
Is there anything else we should be doing between now and when we come back?
I want you to keep the arm elevated above the heart, and you can ice it as needed. I don't want you to get it wet, and I'm going to show you a little finger exercise I want you to do every hour or so. See what I'm doing? You want to make sure you bend every single joint in your fingers. That's good. And I'm going to show you one more exercise. See how your fingers turn white, but then they turn pink again in less than 3 seconds? That means your blood flow is normal, and that's what we want. If that changes or you start to experience any numbness, I want to see you in here ASAP, okay?
Okay.
Thank you, doctor.
You're welcome.